So ADRD is an acronym for Alzheimer's disease and related dementia. And it's an umbrella term that really subsumes diseases, neurodegenerative processes, typically impair memory, cognitive function, and our ability to do complex daily activities. ARCHES stands for Aging Research Characterizing Health Equity via Social Determinants. We wanted something to be emblematic of St. Louis, Missouri. It is a prospective, observational, 5-year study that was funded by the National Institute on Aging. And we are essentially following 300 middle to older African Americans. Most of the research, not just in aging and Alzheimer's disease and related dementia, has been done in what we call weird samples. And weird is an acronym for white, educated, industrialized, rich, democratic samples. And so part of the work that we intended to do was to shift that paradigm.
It specifically focuses on those who live in St. Louis. We want to specifically look at the Black population only and understand the nuances and the spectrum of Black folks. Research is one of those things where it can be kind of dicey because you're dealing with asking people essentially for their time. And in some situations, like for us, we're doing a blood draw, we're doing MRI, so we're asking not only for their time, but a piece of them. And so it's important when you're asking for people to do these things that you come to them as a human, as a fellow individual who also cares about this topic. We do a lot of work within the community, so we regularly go out to recruitment events. We're constantly engaging with folks who are in the community. So we have our own community advisory board, our data and safety monitoring board, made up of physicians, nurses, stakeholders in the community that really have their finger directly on the pulse of those living in St. Louis.
So St. Louis is super divided. Oftentimes we think about a street called Delmar Boulevard, which is the dividing line in St. Louis. So north of Delmar is where historically Black Americans live and continue to reside today. South of Delmar is more mixed, but predominantly white in many areas along Delmar. And it's stark. You can see it immediately driving down the street, what things look like on the north side and on the south side. So there's a lack of health promotion or health promoting resources on the north side of St. Louis. So the dynamics of this region play a major role in fueling health inequities in general, but we suspect Alzheimer's disease and related dementia as well.
What we're looking into is brain health, more specifically Black health. A lot of the studies that have been done already are using mostly white participants. So they're not really considering things that we have to go through, like a lifetime of stress, dealing with things like discrimination, racism, financial strain. The neighborhoods we grow up in, the air we breathe, the food we eat, all those things play a factor into that increased number. So we're just trying to, really be boots on the ground about it and figure out how all of that stress is increasing the numbers of, why we're developing Alzheimer's at such an alarming rate.
We're always looking to create new connections to get more people involved in the study, and not just for research participation, but also for people to know what the work is about so that we can have dialogue and we can talk to people, we can answer their questions, and we feel like that's part of a sustainable partnership off into the future.